Hello, welcome to this webinar. My name is Olivia Duffy. I'm a health educator for Argus Community's C.A.T.C.H program, which is Community Action to Combat HIV and Hepatitis C. My position as a health educator includes HIV testing, hepatitis C testing, and doing group and confidential sessions on any type of HIV, sexual health, mental health, and tobacco cessation. So since August, we've been doing a series on tobacco use. We've been doing all ranges of things from specific demographics such as LGBTQ community. We've done tobacco products, we've done tobacco cessation, and we are now currently doing another one geared towards tobacco use among people living with HIV. So if you haven't checked out any of the other webinars and would like to know more, you could always look at our YouTube channel, Argus C.A.T.C.H, where you could do our previous webinars. We also do a sexual health webinar as well. So next slide, please, Sean. So like I mentioned before, this is a tobacco use among people living with HIV. So the purpose of this is to bring awareness to the health effects tobacco brings on individuals living with HIV. And it kind of shows what happens when the body, when a human not only tests positive for HIV and goes untreated, along with the effects of smoking and what that can do to an individual health-wise. So this is what the purpose of the webinar is, and hopefully you leave this with the education on what can happen. Next slide, please, Sean. So, of course, I wanted to talk about what is HIV. So a lot of people, there is a lot of still misinformation about HIV. So HIV stands for human immunodeficiency virus, which comes from, again, HIV. The acronym. What HIV actually does is that it attacks our white blood cells. The scientific name is the CD4 T cells, and these specific white blood cells are the ones that help us fight off infection. So these are our fighter cells. So when HIV seeks these specific white blood cells, it then attaches itself to it and then penetrates these healthy cells, and then integrates the nucleus of the healthy cell and then tries to replicate it and make new copies of HIV so it can continuously spread throughout the body. And then this, of course, destroys the white blood cell that it integrated into. One single HIV cell can actually destroy like 10,000 healthy cells. So that's the effect of HIV, the virus in the system. And if HIV is not treated properly, it could lead to the acquired immunodeficiency syndrome, which is AIDS. I quickly putting that in here because a lot of people tend to use that interchangeably, especially from the beginning stages of when we first learned about HIV. They are not interchangeable. AIDS is the last and third stage of HIV progression, which I will actually get into in later slides. Next slide, please, Sean. Okay, so HIV is transmitted by unprotected sex, so either anal, vaginal, or oral, and that's usually with someone who has HIV. Sharing needles, syringes with anyone who is HIV positive. Like I said, it's through the blood. HIV is transmitted through sexual fluids, the blood, and now mother to child in womb, during birth, or breastfeeding. So these are the only three major ways that HIV can be transmitted. So unprotected sex, not using a condom, sharing needles with the blood still on it or any type of fluid still on it, and mother to child. Next slide, please. HIV is not transmitted by touching, hugging, tears, sweat, kissing. There's not enough HIV in the saliva to actually have the transmission. Even though with our tests, we do the saliva antibody test, there are antibodies in your saliva, but that does not mean that you can transmit it through the saliva. That's something important to note. You can't get it from sitting on toilet seats, you can't get it from insects or pets, and you can't get it from water. HIV is not airborne. I know we hear airborne a lot, especially in this time. We are still in the middle of a pandemic. Airborne is thrown out a lot because COVID and the flu and all those other viruses can be airborne and last in the air, but HIV cannot. It's not one of them, and it can't last outside the human body. Much different from hepatitis C, it can last on certain objects through the blood. If there's like a nick if you're using a razor and you have a nick and you are Hep C positive, Hep C can last on the razor, but that cannot happen with HIV. There were a lot of misinformation, especially with social media, on people finding HIV in fruits and oranges, and that is not possible because HIV is human immunodeficiency virus, can't last outside the human body. So I had to make that point. Next slide, please. So I'm going to talk into the stages of HIV. This is very important because it does show you kind of the progression of how if a body goes untreated, how HIV can progress into the body. And like I said before, when I talked about a little bit about AIDS, there's 3 stages in HIV. So it's the acute infection stage, the clinical latent stage, and then the AIDS stage. So the acute infection stage is right when you test positive for HIV or when your body's exposed to HIV. So your immune system prevents your body from acquiring a lot of diseases and infections, right? We talked about the white blood cells. These white blood cells really defend you against any other viruses. Well, they at least try to come into your body. They defend you against the bacteria and other organisms that can make you sick. So like I mentioned before, with HIV, when it attacks these white blood cells, your immune system weakens. So it tends, like, once you get it in, it just destroys a lot of your white blood cells, therefore it weakens your immune system. So when you first get exposed to it and you do test positive, early on, your symptoms could be kind of mild enough to not really notice much of a difference. You may experience, I would say, more flu-like symptoms. I know a lot of that's always thrown out here now. Flu-like symptoms can be pertaining to literally any virus. You could have flu-like symptoms with COVID. You could have flu-like symptoms with flu, and you can have flu-like symptoms with HIV. So a lot of times it could be dismissed, and you won't really test for HIV specifically because there's so many other viruses that have the same symptoms. Usually the symptoms last about a few weeks, and this is, again, associated with the first stage of HIV. That's why it's called acute infection stage, because it's so short. But you may not have many serious symptoms, but the virus is rapidly reproducing in your system. So this is when that stage is. But the flu-like symptoms I'm talking about are fever, chills, night sweats, diarrhea, headache, muscle ache, joint pain, sore throat, rash, swollen lymph glands, mouth or genital ulcers. Now going into this, when I talk about flu-like symptoms, if you are someone who's experiencing flu-like symptoms, please go get tested. We're in a time where it is very urgent because you don't know what you have. So it's very important to get tested, whether it is for HIV, for COVID, or for the flu. It's important to be safe. And if you do have HIV, the earlier you get tested, the earlier on you can get treatment and, live a healthy and happy life. Next slide, please. Okay. So this is what I was talking about, the clinical latent stage. This is the second stage. So when I'm talking about these stages, I'm talking, and like I mentioned in the previous slide, get tested early so you can get on treatment and, live a happy, healthy life. When you don't get treatment, obviously HIV progresses more into the body. So this stage is called the clinical latent stage. So usually after 6 weeks after your initial HIV exposure or infection that it came into your body, there is a very slow reduction in the number of CD4 cells. So with time, and then it usually gradually increases the HIV particles in the body. So you don't really notice it, obviously, in your body, but this is when your CD4 cells are really cutting down, and the HIV cells are really progressing in the system. On average, it lasts 8 to 10 years this stage. In some cases, it can last a lot longer. You may or may not even show signs or have any symptoms during the stage. But as the virus advances, like I mentioned before, the CD4 count cell really decreases drastically. And then this can lead to more symptoms, as fatigue, shortness of breath, cough, fever, swollen lymph nodes, any type of weight loss or diarrhea. But most people who have treatment access do not progress beyond this stage. That's just what I wanted to mention. So next slide, please, Sean. Okay, and now we're on the third stage, which is auto-acquired immune deficiency syndrome. So like what I mentioned before. So this stage typically begins at some point after the CD4 cell count drops below 200 per microliter. So when you have a CD4, because we have thousands, I would say thousands and thousands of CD4 cells in our body because we need them to fight off infection. So now at this stage, HIV has progressed very, very quickly and has had your CD4 cell count drop to 200 per microliter. So it's very, very low. That is what is considered an AIDS diagnosis when this happens, or when the individual who is HIV positive develops one or more opportunistic infections, regardless of their CD4 count. So it's either or when you get diagnosed an AIDS stage, but is characterized by a more rapid increase in the amount of HIV in the body, and your immune system right now is depleted. So there really is very hard for you to fight off infection, which is why once you get the opportunistic infection, you do get to an AIDS stage. So if the HIV infection advances to AIDS, the body becomes more prone to opportunistic infections, like I mentioned, and this puts you at increased risk for more infections. So this includes a specific herpes virus called cytomegalovirus. So this can cause problems with your eyes, your lungs, and your digestive tract. One that was actually, they really found the correlation, especially in the 80s, was Kaposi sarcoma. This is another possible infection. It's cancer of the blood vessel walls. It's rare among the general public, but it's very common in people who are HIV positive. So I do remember that there was, once the HIV epidemic started, they did find that with a lot of individuals who were testing positive, that they were so bad to the point, progressed so far, that they had Kaposi sarcoma. So some of the symptoms include red or dark blue lesions on the mouth and skin. It can cause problems in the lungs, digestive tract, and other internal organs. HIV and AIDS also puts you at a higher risk of developing lymphoma. So it's an early sign of lymphoma is swollen lymph nodes. So this is, if you do progress to an AIDS status and untreated without treatment, this is what puts you more at risk for. If you are on treatment, it does progress kind of reversed. It does help a lot with your body. That's what they say, the earlier the better to get on treatment. But if you do have an AIDS status or diagnosis, you do tend to have stay with the AIDS diagnosis, even though your CD4 count cell could double with all the treatment that you're on. So that is something. So once you get on to that stage, you will still have an AIDS diagnosis, even though you could be very healthy from then on. Next slide, please. So this is the part where I'm going to talk about some of the effects that HIV has on specific systems in the body, and to kind of tie it all in with how does smoking get involved with this. Like I mentioned before, HIV weakens the immune system, but it does a lot to other types of your body. So HIV increases the risk of colds, the flu, and pneumonia. Without the preventative treatment for HIV, these advanced treatment puts you at an even greater risk for complications such as tuberculosis, pneumonia, and a disease called pneumocystis carina pneumonia, which is PCP. And so that causes trouble breathing. It causes cough, fever, very similar things that harm your respiratory system. Your risk for lung cancer also increases with HIV. This is caused by the weakened lungs from numerous respiratory issues relating to the specific weakened immune system. And according to the National AIDS Manual, lung cancer is more prevalent among people with HIV compared to people without it. HIV also raises the risk of pulmonary arterial hypertension, so PAH. This is a type of high blood pressure in the arteries that supply blood to the lungs. Over time, this will strain your heart. And if you have HIV and become immunocompromised, so that means you have very low CD4 count or T cell count, you are more susceptible to tuberculosis, which is a leading cause of death in people who have an AIDS diagnosis. So tuberculosis is an airborne bacterium that affects the lungs. Symptoms include chest pain and a bad cough that may contain blood or phlegm, which can linger for months. So TB, like I mentioned before, that one's airborne, and because you have a weakened immune system, you're at a greater risk for it. Next slide, please, Sean. So how it affects the digestive system. How does HIV affect your digestive system? So since HIV affects your immune system, like I've mentioned plenty of times, it also makes your body more susceptible to infections that affect your digestive system. So your digestive tract, it can also decrease your appetite and make it difficult for you to eat properly. And so that's why weight loss is seen as a common side effect for people who are HIV positive. A common infection related to HIV is the oral thrush, which includes the inflammation and a white film on the tongue. It can also cause inflammation of the esophagus, which can make it difficult to eat. So another viral infection that affects the mouth is oral hairy lycoplakia, which causes white lesions on the tongue. Salmonella infection is spread through contaminated food or water, and it causes diarrhea, abdomen pain, and vomiting. Obviously, anyone can get that because it's through contaminated water, but if you are HIV positive, you are at a higher risk of serious complications from the infection. And any type of consuming of any type of contaminated food or water can also result in a parasitic intestinal infection called cryptosporidiosis. So this infection affects the bile ducts and intestines that can be particularly severe. But people who have an AIDS diagnosis, this can cause chronic diarrhea. And there is an HIV-associated nephropathy, which is HIV-AN, is when the filters in your kidneys become inflamed, making it harder to remove waste products from your bloodstream. Again, this is emphasizing this is if you are not on treatment, if HIV progresses through your body. Next slide, please. Okay, so this is how it affects the central nervous system. HIV doesn't necessarily directly affect nerve cells, but it does affect the cells that support and surround the nerves in the brain and throughout the body. So while the link between HIV and neurological damage isn't really completely understood, it's likely that the infected support cells that contribute to the nerve injury, that's where the correlation comes in. So advanced HIV infection can damage nerves and small holes in the conducting sheets of peripheral nerve fibers, which are vascular myelopathy, can cause pain, weakness, and difficult walking. There are significant neurological complications with the AIDS diagnosis. HIV and AIDS can cause HIV-associated dementia or AIDS dementia complex, two conditions that seriously affect cognitive function. Toxoplasma encephalitis. It's caused by a parasite commonly found in cat feces. It's also another possible complication of AIDS. With the weakened immune system that goes about with an AIDS diagnosis, it could put you at increased risk of inflammation of the brain and spinal cord due to this parasite. And some of these symptoms can include confusion, headaches, and seizures. Some common complications of AIDS, which include memory impairment, anxiety, any type of depression. This is related to the central nervous system. In many advanced cases, there could be hallucinations or any type of frank psychosis can occur. So you may experience headaches, balance issues, and vision problems. Next slide, please, Sean. Okay, so the integumentary, I don't know why I can't really talk today, but the integumentary system. So one of the more visible signs of HIV and AIDS can actually be seen on the skin. So a very weakened immune system can actually leave you very vulnerable to viruses like herpes. Herpes can cause you to develop sores around your mouth or your genitals. There's two types, commonly known, which is called herpes simplex virus 1 and herpes simplex virus 2. Herpes simplex virus 1 is usually surrounding the mouth-to-mouth contact, and HSV2 is usually genital, but they can be cross-contaminated if you are giving someone oral or some sort of that skin contact. So that actually leaves you more, but when you have HIV and it progresses to an AIDS diagnosis, it could actually leave you more vulnerable to contracting herpes. So HIV also increases your risk for rashes and shingles. So shingles are caused by the herpes zoster, so the virus that can give you chickenpox. Shingles can cause very painful rashes, often with blisters. And there is a viral skin infection called molluscum contagiosum. It involves an outbreak of bumps on the skin. Another condition is called Priugi nodularis. It also causes crusted lumps on the skin, as well as any type of severe itching. And HIV can also, untreated HIV, can make you prone to other skin conditions such as eczema, seborrheic dermatitis, scabies, and skin cancer. So next slide. So as of right now, there is no definite cure for HIV, but like I mentioned, trying to mention it, being very redundant with it, HIV is completely treatable, and any individual with HIV can live a long and healthy life. A lot of what I just mentioned to you was if HIV goes untreated, because some of the time it still does. People, there's still a lot of stigma relating with an HIV diagnosis. So a lot of people are afraid of getting tested, or even they're afraid of, not having the ability or any access to HIV treatment. So it can go undiagnosed, or it can go, further on and do a lot of the damage that not necessarily the damage, do a lot of the effects that I just explained to you about each system. So it is very important for you to get tested. And a lot of this can happen when you're not on medication and properly treating your body. Next slide, please. So now that I just talked about the causes and effects of HIV, how is smoking really related to HIV? So smoking causes 1 in 5 deaths in the United States each year. About 1 in 5 Americans smoke cigarettes. So this in general can cause cancer, cardiovascular, metabolic diseases, respiratory diseases, and perinatal diseases. Cigarette smoking in general causes several forms of cancer. So that is including 90% of the lung cancer deaths. Non-smokers who are exposed to secondhand smoke at home or at work have a 20 to 30% higher risk of getting lung cancer. Smoking also causes cancers of the voice box, which is the larynx, mouth or throat, esophagus, bladder, kidney, liver, pancreas, cervix, colon, rectum, and stomach, as well as a type of blood cancer called acute myeloid leukemia. In addition, it can interfere with any type of cancer treatment, decreasing the risk of reoccurrence and more serious complications and death. So cancer does a lot. Smoking does a lot to your body, and it has some very negative effects, like I mentioned previously. It is a major cause of heart disease and stroke, and causes 1 in every 4 deaths from heart disease and stroke. Non-smokers who breathe secondhand smoke or at work or at home have 25 to 30% higher risk of heart disease and a 20 to 30% higher risk of stroke. Smoking can damage the body by raising triglycerides, which is the type of fat in your blood, and lowering high density lipoprotein or good cholesterol. And it also makes your blood sticky and makes it more likely to clot, which can block blood flow from the heart and the brain. So damaging these cells that line the blood cells, and they increase the buildup of plaque in blood vessels and cause blood vessels to thicken and narrow. So that I mentioned all this of what smoking can do. If you smoke and have HIV, there are many related HIV infections that go hand in hand with smoking. So I mentioned thrush, I mentioned hairy leukoplakia, bacterial pneumonia, and pneumocystis pneumonia, which is a dangerous lung infection. So if you already have HIV you're going treated, and then you're smoking, you have a greater risk of to get some of these HIV related infections. HIV individuals have already higher rates of smoking than the general public. So HIV positive smokers lose more life years to smoking than to actual HIV. And not surprisingly, the respiratory syndrome is particularly susceptible to the damaging interactive chronic inflammatory and immunosuppressive effects of both HIV and smoking. Like I mentioned before, I did the whole thing on the respiratory system on how HIV can affect your lungs and weaken your lungs. So it intensifies the risk of developing any type of opportunistic infection when you smoke and you go untreated as an individual is HIV positive. So next slide, please. So tobacco use is a serious threat, regardless of who it is, but it's particularly dangerous for people living with HIV. Tobacco use is the leading cause of preventable diseases, disabilities, and death. Even smoking related illnesses cost society over $300 billion each year, which includes $170 billion in direct medical costs. So these costs could be very reduced if we prevent young people and we start, the education from starting to smoke and help smokers quit and give them all the resources that they need and the education in order for them to quit. Smoking raises your risk for heart disease, cancer, serious lung diseases, and infections such as pneumonia and other illnesses. And like I said, people who are living with HIV are more likely to develop these harmful consequences of smoking than those without, because you already have a weakened immune system from the virus, and it does a lot of damage from the system that a lot of people don't talk about. So when you add on to something that is already so detrimental to your health, it does speed up the process of any type of severe risk. And unfortunately, a lot of people do lose their life from this. Next slide. And this is just another one to reiterate which systems that smoking and tobacco use has an effect on. It affects your circulation, your heart, your brain, your lungs, stomach, skin and bones, mouth and throat, and reproductive fertility. And like I mentioned before, they're very similar systems that they both affect. Add one or the other is going untreated with HIV can do a lot of damage. So can smoking if you are continuously smoking. So this is it's very important to have the education that they both have very similarities in how they go about the body. Next slide, please. HIV and smoking. Obviously, smoking when you have HIV you're more likely to get other serious illnesses than non-smokers with HIV. Like I said, if you're going without treatment in HIV, as HIV progresses in your body, and then you're adding smoking and tobacco use, you're more likely to get other serious illnesses. These illnesses can make you even too sick to go to work or even lead to an early death. And this can include COPD, which is chronic obstructive pulmonary disease, which is a serious lung disease that causes severe breathing. It includes emphysema and chronic bronchitis, because you already have a damaged lung function that increases your risk of getting COPD. Any type of heart disease and stroke, lung cancer, head and neck cancer, cervical cancer, and anal cancer. Next slide, please. I did talk a little bit about the stigma regarding HIV, because there's still a lot of it. Like I mentioned, there's a lot of negative attitudes and beliefs about people living with HIV. It is, the prejudice that comes from labeling an individual as part of a group that is believed to be socially unacceptable. So some of these examples are, believing that only certain groups of people can get HIV, which is not true. From what I said, that a lot of it is just transmission through sexual fluids, blood, or mother to child. There's no certain group of people who can be HIV positive. If you're making moral judgments about people who take steps to prevent HIV transmission, it is still very much out there, and there should be more. You should be able to educate others without getting the judgment on HIV, because it's affecting a lot more people than people understand still. And we still have the treatment for people to live a happy and healthy life, which is, again, another thing. People just see you as, not a willing to, how do I put this? It's more, people see you as kind of shameful, and that's not even the truth. You're still a human being, regardless of what your diagnosis is. And if you feel that people deserve to get HIV because of their choices, which is not true, you can get, like I said, it could be from any specific way or any way of life. You're not a set person just because you have an HIV positive diagnosis. You don't deserve to get really any type of diagnosis. That's not like how we should be as human beings. We should all be able to respect one another, and we should really see, from the progression of how well we've been doing with the HIV epidemic, there's still a lot more to go. And this is the stigma of this is what kind of puts us back, though, even though, like I said before, we're put in a very good progression of helping others who are HIV positive. People are still afraid to get tested. They're still afraid to get the treatment, or be afraid that they won't have the financial support to get the treatment. And, it sets us back, and people are dying. People aren't properly taking care of themselves because of the stigma that is put on HIV and individuals who have it. And, a lot of this comes from insufficient knowledge, misbeliefs, and fears about how HIV is transmitted. Like I mentioned before, when I was talking transmission, people think it's still airborne. People were afraid of, hugging or kissing people who are HIV, and you can't get it through that. They're still human beings. You shouldn't be putting them in this box. But, you can't get it from fruit, like a lot of people were posting. I've seen a lot of those on social media. And there's a lot of misconception, and people were, sharing this, and also, there's the life potential and capacity of these individuals. There's no immediate death with HIV when you have an HIV diagnosis. There's still a lot, like I mentioned before, stress a lot. There is still art therapy. There are medications that you could take in order for you to live a life and, repress HIV. You can get to a point with HIV that, it's untransmittable when you get on treatment. We call it U equals U. So, when it's undetectable in your system, it is untransmittable. There are many moral judgments of people who we assume have been sexually promiscuous. They see it as that, but that's not necessarily true. Like I mentioned before, you don't have to get it just through sexual fluids. It is also through the blood. So it's not just a set assumption that person got it from them. There's a lot of fear about death and the disease. And like I mentioned before, people can live a very happy, healthy life. They can repress it in their systems with the treatment. They can still live a good life, but unfortunately, like I mentioned before, if it goes untreated, it can lead to more severe risks for opportunistic infections. But it's important to be able to have the support from your friends and family if you are someone who is HIV positive, or from your providers, that you could get on the proper treatment for you and live your healthy life and build up your CD4 count cells. Obviously, with the misinformation, it could still be physical and social isolation from families, friends in the community. There could be a lot of gossiping, name calling, and condemnation, and loss of rights and decision-making power with a lot of individuals who are HIV positive or in fear of getting tested and getting treatment. So it affects, a lot of things, and it can also affect the emotional well-being and mental health of people living with HIV. And it's, often internalized stigma that they experience and begin to develop a negative self-image. A lot of them do use smoking as a stress reliever, which a lot of them tends to go into smoking, and which causes a lot of these effects that I previously just talked about. They may fear that they will be discriminated against or judged negatively if their HIV status is revealed. Internalized stigma or self-stigma happens when a person takes in the negative ideas about this. So it does lead to a lot of feelings of shame, fear of disclosure, isolation, despair, and then it just keeps people from getting the treatment, but it also keeps people from getting tested if they think they're HIV positive. Unfortunately, like I mentioned before, there is no cure for HIV. So with people just refusing to get tested, it's going to progress. And the earlier you get tested, you're more likely to get right there and then there, like I mentioned before, get all the proper amenities that you need. So you could stop. Next slide, please. So one of the things I did want to talk about is how to stop the stigma and the spread of information is just to educate yourself. Like I mentioned, there's so much misinformation that goes with HIV and the effects of it. If you don't know anything, don't make a judgment about it. We're all human beings, and it's important for us to be educated on stuff that we think we know, but we don't know the full facts of. There's still a lot of people who think a lot of it, especially from the 1980s, they still have that kind of mindset on it, which is not true. There's so many preventative medications now. We have PrEP and PEP. We are pulling a full, condom use is up. We're doing education on condom use because these are some of the preventative measures to take in order to end the HIV epidemic. You also need to know how to talk about HIV. As an HIV health educator, it is my job to talk about HIV and talk about, the misconceptions of it and the myths and debunk them, because it's very important in the community to understand what it is, how to get it, and how we can educate ourselves so we can educate others. Also be aware of your attitudes and beliefs. We are all, like I mentioned before, we're all human beings. We're all living our own lives. It is so important not to judge someone just because of a diagnosis or what their risk behaviors are. Because like I said, we're all human beings. We got to live our life. All we could do is just educate each other and, have support, give support. Another one is educate healthcare workers, family or acquaintances. Some people, like I mentioned before, a lot of people aren't educated, and that can still go for a lot of healthcare workers and, your family and your friends. So not only do you have to educate yourself, you should be able to educate others on it, which is very important because, like I mentioned, as a health educator, that's what you want to do. Give people the education that they need so then they can relay it out into the world, even if they don't need it. And like I mentioned, support individuals living with HIV. It is very important because, they, with all the stigma going around, they are, have a fear of disclosure, feelings of shame. It's important to have support for them. And so they're able to access all that they need for living with HIV. Next slide, please. So I mentioned before preventative measures and how to reduce the stigma. Number one, if you don't want to have sex, you don't have to. Abstinence. That is one of the best preventative measures. But if you do want to have sex, we're just going to give you the education that you need. Use a condom the right way every time you have sex. Make sure it's fitted. Make sure it's on properly, because a lot of people do have some type of misconception with condoms. They don't like them. If people are like, oh, I'm on birth control, I don't need it. No, always use a condom. Because condoms are very good because they help with preventing STIs and they help prevent pregnancy. So this is really the only contraception that can do that. Like I mentioned before, get tested and treated for other STIs. I should say STIs, but having the other ones, like STIs, increases your risk for transmitting HIV. So it's important to get tested. Like I mentioned before, if you are HIV positive, you should please get tested so you can get on medication as soon as possible, and it will help build up your CD4 count, so it will strengthen your immune system. Consider PrEP and PEP, like I talked about before. PrEP is pre-exposure prophylaxis. PEP is post-exposure prophylaxis. Very, very important. PEP is post-exposure. So if you think you've been exposed, go to the clinic and ask for PEP in a 72-hour period, and you'll be on the regime for 28 days to taking medications, and then you'll get tested for HIV at the end of it. And it is very and highly, highly effective. PrEP is pre-exposure prophylaxis. So you take a pill a day. It helps reduce HIV from coming into getting exposed to HIV and it coming into your system. Very important. And don't share needles. Like I mentioned before, it can come through the blood. So make sure if you are someone who is sharing needles, or you do use needles for any type of drugs that you do take, just make sure you aren't sharing new needles and use a new needle every time. I mentioned hepatitis in the beginning of this webinar, but hepatitis can be transmitted also through needles because it's through the blood. So just make sure you're using a new needle every time. And the last one is quit smoking. There is a lot that, obviously that's such a like an umbrella term, quit smoking. There's obviously a lot of things you need to do in order to get to that mindset, but it's important for people to at least consider it. We don't give this webinar or any of the series just to harm you in any way. We're doing it for your education and to help provide resources that you can. As a team, we have talked about how, smoking, it really does take about at least 7 times to fully quit. Just there are many other ways that you can quit, and just learn for the ones that can be beneficial to you. Next slide, please, Sean. And one thing to mention about quit smoking, it will never be too late to quit. These are a few of the quitting smoking recommendations that we take for you. One is nicotine replacement therapy. Try to avoid your triggers. Delay in smoking. Try to get physical. Do some exercise. Practice relaxation techniques. Do some meditations. And call for reinforcements. These are just some of the ways that you could do it. But again, you are you. You really know what's best for your body. So if you want to do a specific way, go ahead. Go ahead. Next slide, please. But these are some of the facts that if you do stop smoking, you'll notice a difference after 20 minutes. Your heart rate and blood pressure will drop. 12 hours, the carbon monoxide level in your blood drops to normal. 2 weeks to 3 months, circulation improves, lung function increases. 1 to 9 months, coughing and shortness of breath decrease. Cilia, which is the tiny hair-like structures that move mucus out of the lungs, start to regain normal function in your lungs, increasing the ability to handle mucus, clean the lungs, and reduce the risk of infection. 1 year, the excess risk of coronary heart disease is half that of a continuing smoker's. 5 years, risk of cancers of the mouth, throat, esophagus, and bladder are cut in half. Cervical cancer risk falls to that of a non-smoker. Stroke risk can fall to that of a non-smoker after 2 to 5 years. 10 years after, your risk of dying from lung cancer is about half that of someone who's still smoking. Risks of cancer of the larynx, which is your voice box, and pancreas decrease. And after 15 years, your risk of coronary heart disease is equal to that of a non-smoker. So very important to know these facts. It's never too late to quit. A lot of people do have that negative connotation that once you start smoking, you already have that damage. But like I said, even if you are someone with HIV who's going through like a clinical latent stage, you could still very much get on treatment and, build up your CD4 cells. Nothing's really permanent in that stage. And like I mentioned before, if you have a CD4 count of 200 and you have an AIDS diagnosis, that is not, now with treatment and now with how we progress as a society, you could very much build up your immune system and live a healthier life. Nothing's really detrimental, especially at this stage. If you stop smoking, same way, you'll notice a difference. So if you stop smoking and you do get on treatment for HIV, you'll see tremendous results and you'll have a lot of already the prevention measures taken for a lot of what I talked about with the effects of it. Next slide, please. So if you need help quitting, these are some of our resources. ACN Tobacco Cessation Services, which is New York Presbyterian Columbia. So these appointments are made available at multiple locations across the ambulatory care network, which ACN stands for. Specific locations, and to schedule an appointment, you have to call 1-866-463-2778. Smoking cessation classes are also available through New York Presbyterian, including individual, group, or behavioral counseling sessions. So you can call the numbers listed below for more information or services to make an appointment. Montefiore Health System Tobacco Cessation Program, which is in the Bronx. You can call 646-988-2859, so you can call for an appointment. NYC Health and Hospitals Gotham Health Cumberland Behavioral Health Pavilion Smoking Cessation Program. Ooh, that was a lot. But they're located in Brooklyn, and they are 718-260-7756. We will have all these resources with us and put it in our description box. There is another health and hospitals, Elmhurst, which is in Elmhurst, New York, 718-334-2550. So there's no appointment required. The Richmond University Medical Center Tobacco Cessation Program, which is in Staten Island, that's 718-818-239. And these are free programs available throughout the year. So just contact the Smoke Tobacco Cessation Program for exact dates and times. Very important information. We'll have them linked below if you are someone who's seriously considering quitting, and will like the resources and help and support. Next slide, please. So I just want to thank you all so much for for hearing me out and joining this webinar. I just would like to talk about a little bit about what we do as an organization. Like I mentioned before, I'm a health educator for the C.A.T.C.H program, Community Action to Combat HIV and Hepatitis C. One of my fellow coworkers, Christopher Olin, he is our behavioral health coordinator, and he provides a lot of resources and can help others in the community. So what he personally does is HIV and hepatitis C pre and post test counseling. He does GPRA, which is the Government Performance and Results Act. He connects clients to HIV and hepatitis C medical services. He connects clients to substance use services, which also include smoking cessations. He connects clients to mental health services, connects clients to local food pantries, and assist uninsured individuals to get access to medical insurance. So he's very good at his job. So if you ever need someone who has the resources, if you're someone who needs help, regardless of, trying to with substance uses or any type of tobacco cessation, he's your guy. Next slide, please. And this is just our staff. Like I mentioned before, my name is Olivia Duffy. I'm a health educator. I, along with my coworker, Yumina Castillo, also do the tobacco cessation webinars every Tuesday. I do the 2 p.m. She does the 6 p.m. I mentioned Christopher Olin, our behavioral health coordinator. I explained what he does. And Sean Belgrave, who's the fabulous man behind this. He's the technical coordinator in all this. Couldn't do this without him. So thank you very much, Sean. Next slide, please. Again, thank you so much. If you have any questions, comments, concerns, this is some of our information. You can contact us at the arguscatch@gmail.com. Our number is 929-322-4106. You can also find us on arguscommunity.org with many of our programs for Argus Community. We are usually mainly located in the Bronx, but we have branched out, like my office is in Manhattan. We also have many other locations in Queens and in Brooklyn. And you can also follow us on social media. So we have an Instagram, a Twitter, a Facebook, and this is our linked tree, which we linked below. Next slide, please, Sean. And again, like I mentioned, we do a tobacco cessation webinar every Tuesday. So be sure to check us out. You could always register on our Eventbrite events. And we are the C.A.T.C.H program. We also, like I mentioned briefly in the beginning, we do a sexual health webinar, which is at 2 p.m. on Wednesdays. So be sure to check that out from our lovely team. And thank you so much. And I hope you guys have a great day and stay safe. Bye.